Introducing the Endocare Growth Factor Facial. We begin the treatment by cleansing with Endocare Gentle Cleanser, followed by an exfoliation using the glycolic and salicylic wash. The Endocare Gentle Cleanser is oil-free and kind to skin, has added moisturisers to leave the skin soft. Use a 20p size amount and foam up with water. Massage over the skin. And then remove using damp gauze. Next, we exfoliate using the Endocare glycolic and salicylic wash. This will remove dead skin and also excess oils while still being gentle. Use a 20p size amount and foam up with water, and then massage over the skin. We then remove using damp gauze. It's important that we thoroughly sterilise the skin. We are now going to set up the microneedling device. Remove the needle tip from its sterile packet and insert into the handpiece by screwing it in. Make sure the device is set to 0 when you do this. We then dispense 2 Endocare Growth Factor concentrates into a gallipot. This will be used as the glide for needling whilst also feeding the skin with intensive growth factor complex. This is then applied with a gloved finger to the first treatment area, and we will keep applying as we go along. We then need to adjust the needle length for the area we are working in. In this treatment, the needle length we use is between 0.1 and 0.3. This table demonstrates the recommended needle length and the speed for each area being treated. We begin the treatment at the forehead. Work in an area the size of a 2p. Within that area, you're going to draw small circles, creating a flower-like pattern. We then move on to the eye area. It's important to stretch the brow so we can really treat under the eyebrow. And when working under the eye, stretch the cheek down and work in and out under the eye. We then go on to the cheek area, and it's nice to get a good stretch on the cheeks as well. You should be looking out for some erythema. We then go onto the nose. Onto the top lip. And we finish at the chin. The skin should have slight erythema, but there shouldn't be any blood spotting. Next is the lift and sculpt massage. The movements in this massage should be done with a firm pressure, always making sure that you are lifting upwards and sculpting the contours. We then apply the remainder of the Endocare Growth Factor concentrate onto the skin. We'll be using this to massage. Prayer move over the face 3 times, stretching the brows and smoothing the forehead each time. Then firmly sculpt along the jawline. We then lift and flick the cheeks in a quick motion to encourage circulation and plumpness. Sculpt under the cheekbones firmly 3 times, really stretching the face. Using fingertips, drain under the cheekbones and then pray over the face to link to the forehead. Next we're going to work on droopiness of the brow. Firmly knead along the brow, really lifting it upwards, and then step back and drain along the brow. We then repeat on the other brow. Concentrating on the frown lines, pinch and knead between the brows. And then with flat hands, firmly smooth the forehead. And we then finish with a prayer move. The Endocare Tensage Gel Cream is used as a rich, intensely hydrating mask to infuse the skin with the intensive growth factor complex to stimulate collagen, elastin and hyaluronic acid. Using a heat spatula mount, wearing gloves, apply liberally over the face. We then apply the dry sheet mask over the face, placing it the coated side onto the skin. Smooth down, making sure that the eye holes, nose and mouth are in place. Next is the pressure point massage. We then begin the pressure point massage working on top of the dry sheet mask. Use a firm pressure and hold each pressure point for around 4 seconds. This is going to allow deeper penetration of the Endocare Gel Cream mask, whilst also helping to release tension and pressure on the face. Once the mask has been on the skin for a further 5 minutes, peel back the dry sheet mask and remove any remaining Endocare Gel Cream using damp gauze. To complete the treatment, we protect the skin with a Endocare of choice. Apply Endocare liberally all over the skin, massaging in. This is going to give your client the ultimate protection post-procedure. Make sure you're recommending that they use Endocare every day. For the treatment course, we would recommend having 3 treatments. Each treatment would be performed every 2 weeks, and we'd recommend that you return every 3 months to have another course. Alternatively, you can have a one-off treatment which is going to be perfect as a pick-me-up facial prior to a special event. To maximise the effect of the Endocare Growth Factor Facial, we recommend to use the Endocare Tensage Concentrates throughout the treatment course. It's a 30-day programme and uses the strongest SCA growth factors at 50%. They're designed to be used in the evening And these concentrates will help to boost the growth factor activity to switch on collagen production within the skin. Once the treatment course has been completed, continue the amazing effects of the Endocare Growth Factor Facial. Use the derma roller at home twice a week, followed by the Endocare Tensage Serum. The home roller is simple and easy to use. Make sure the skin is cleansed and dry. Work in small areas, rolling 3 times vertically, horizontal, and then diagonal each way. Keep doing this until the area has been covered, and then move on to the next area. Once you have rolled over the whole face, we then apply 2 to 3 pumps of the Endocare Tensage Serum all over the face. Repeat this twice a week. You must thoroughly clean the roller after each use. Rinse under the tap and then spray with the steriliser and place back into the holder.